Good morning, YouTube family and friends. Hope you had a great week. My week it was okay. It was okay. A lot better than what it has been the last few weeks. Today is Saturday, July 13th, 2024, and this is week 16 results being back on Mounjaro. I'll give you updates on all my lovely medical issues that if you've seen prior videos, you know all about. Yeah, trying to keep a positive attitude is really hard sometimes, but it, it is what it is. You can't do much about it. So, yeah, on top of just updates, I'm also going to do a measurement this week. It's been 2 months since I did a chest and gut measurement to see inch wise. Most likely, it's not gonna be smaller. That's for sure. It's gonna be either stay the same or it's gonna be increased because of the weight gain. So, and I'm also going to check my blood. I want to see where it's at because of the weight gain. I'm curious to see. I haven't poked my finger in a few weeks, so curious to see where that's at. So all right, so let's just get into it. We'll start off right away with weight loss or weight gain. Usually I wait till the end of the video. I'm going to give it to you at the beginning of the video this week for those of you who'd like to know that and aren't interested a whole lot in my other medical issues. So I stepped on the scale this morning. Last week I weighed in at 230 pounds, which was a 5 pound weight gain, which puts which put me at week 16 of only a total loss of 6 pounds. So yeah, that stung last week, gaining 5 pounds. That's a lot of weight to gain. I was hoping it was just a flux. It wasn't a flux, folks. Today I stepped on a scale. It was still at 230. So at least it was a zero. I didn't gain anything, but I also didn't lose anything, which means last week wasn't just a flux week. It was a real. So yeah, so that's zero. So my total weight loss for the 16 weeks is just 6 pounds. I know with me being diagnosed with hypothyroidism and being on medication, there's a chance for weight gain on it. I really, I really like being on this stuff. It's called levothyroxine, Levothyroxin. I'm on just a small dose of 25 mcg. Yeah, I don't know if you can see that or not, but it does some of the issues I was having that we were trying to resolve. This medicine's actually helping. One is my bad leg and feet cramps. I used to get cramps so bad at night, especially laying down trying to fall asleep. Or I wake up and with my foot cramping or my calf cramping. Oh man, those cramps are horrible. And we were trying to figure out what was causing it. Well, ever since I've been on this medication, I haven't had one single cramp. So those cramps must have been tied to thyroid, my thyroid issue. So that's good. The cramps have totally gone away, and it's just been on a low dose. So it's a low dose, and they took the cramps away. I'm so thankful because those cramps were painful and they're hard to get rid of. Another thing is, as you know, I have bradycardia, which is a low pulse, and having hypothyroidism that could cause the bradycardia. It slows things down. So I haven't had one instance of my pulse being in the 40s ever since I've been on this medication. Yes, I've had in the 50s. Was it 2 nights ago? I checked it as I was laying down going to bed, and it was 51. But that's the lowest it's been. Usually it's been in the mid to upper 50s or 60s, a lot of 60s. So this thyroid medicine is helping my bradycardia, which is awesome. What I don't know is my thyroid issue a direct result of having myasthenia gravis, the autoimmune disease, or not? Of course, it's not official. I don't officially have MG yet. It's I still need to see a neurologist for the official diagnosis. All I have right now is the blood work. The blood test came back for the antibodies positive. I think I talked about that last week. For it to be negative, my antibodies for that blood test should have been zero point 0.4 or less. My blood work came back at 26.6, which was high, which means I have the antibodies for myasthenia gravis. So most likely I do have MG. According to the blood work, I have MG, but it's not official until the neurologist diagnoses me. So, and as you know from last week's video, I got the there's my primary doctor is saying that it's an emergency, so they're trying to get me in sooner to see the neurologist. But neurologists can be upwards of 6 months or longer to get in to see it. And when they called up the neurologist's office uh, to try to get the appointment for me, the neurologist called me back and said, "Okay, we got you an appointment not till October 11th, so 3 months." What? But I was being put on a wait list. Well, thankfully, my primary doctor was not happy with that. So they wanted me to be seen right away. So they called me back this last Monday, my primary doctor's office, the nurse, and she said that she called the neurologist's office back up and they were able to get me in sooner. They said they could squeeze me in on July 18th, which is this coming Thursday. It was just penciled in at the time because this was when they called me back with this appointment. It was actually July 3rd, Wednesday, and so but it was just the day before 4th of July, and the person in charge of the neurologist's calendar for bookings was already off, so they just penciled it in, but they thought they could squeeze me in. So, but it wasn't official until I heard back from them or I saw the update on my chart. And thankfully, I got the update this week on Tuesday for my chart. So, yay! I'm officially seeing the neurologist next Thursday, the 18th in the afternoon. So, hopefully for the official diagnosis, so we can get started on some type of medicine, some type of treatment plan. And I'm sure they'll want to do other tests. I'm sure they're going to want to check my thymus out to see if it's enlarged or if it has any type of tumors. So that's usually a CT scan or an MRI or something. So, but we'll see what the neurologist says. As you can see, I got some droopiness in my eyes. Uh, my right eye has always been worse than my left eye. I have had an instance of my left eye drooping now. I'm getting blurry vision and double vision a lot. So, but when I woke up this morning, I've been up for about an hour and a half now. But when I first woke up this morning and looked in the mirror in the bathroom, my right eye wasn't too droopy. If I raised up my eyelid, this is kind of what it looked like. It looked almost normal. But now that I relax, it droops back down. So it's starting to droop already. I've only been up for an hour and a half and it's already starting to droop on me. So, but thankfully I haven't had any double vision or blur. But you can tell, look at my eye. Look at the white in the eye versus the white over here. You can tell this eye is geared more towards that way than this one. They're not totally in sync. But if I look straight ahead, I'm fine. I have noticed if I'm looking downward, I don't have an issue with double vision or blurriness, but when I look up high or look sideways, I can't. Especially, I lose my peripheral when my eyelid's drooping a lot. I lose my peripheral on this side. So if I look this way, I can see just fine out of the corner of this eye. If I look that way, right now I kind of see it. It's not wholly blocked, but when the droopiness gets more, which is usually within a few hours after I wake up, it gets blacked out because my iris, my thing you look at is under the flap, under the eyelid, so it goes dark on me on that side. So I see up to my nose and a little bit on this, but then that's it because the rest of my eye is under the eyelid. So I lose when my eyes drooping. I lose my peripheral on the right side, which is one of the reasons why it's hard for me to drive Uber. It's hard for me to drive in period when my eyes get tired. So I haven't done my second job a whole lot at all for several weeks now. I did try driving last night because I only worked a few hours my main job because I had my doctor's appointment. My dad had a doctor's appointment, which I had to help with because he has to be pushed in a wheelchair. So I only worked a few hours my main job yesterday. When I got back home from my dad's doctor appointment, I took like an hour nap, so I was kind of rested. So I went ahead and drove. I was able to drive Uber last night for 4.5 hours safely. But after 4.5 hours, my eyes started to get tired and they started to go a little wonky on me. And that's when it's not safe. So I had to call it a night. But at least I was able to drive for 4.5 hours last night, Uber. I made 100 and I got it. I made $111 last night in 4.5 hours for Uber. So you know what? It's an extra $111 I didn't have. So I'm really thankful for that. We'll see how I can do today. Like I said, I don't work my main job during the weekends, so I'll want to try to drive Uber again while my eyes are okay today. And I said I'll be safe. I don't drive once my eyes start to go wonky on me, where I feel like it's not safe no more to safe drively. Then I'll call it. I'll call it. So I will be safe. But yeah, I gotta get some extra money coming in. So okay, there's the update on that. So stay tuned for that. The only other my doctor's appointment I had yesterday was actually with the dentist because I had that temporary crown in my back tooth, and they were wondering if I would need a root canal or not. No root canal. Yes, because they would want to do a root canal before they put my permanent crown on. So, but that tooth is still alive. It's still very sensitive. I could tell that as they took the temporary off and they were trying to scrape off the temporary cement to hold the temporary crown in. I had a big filling in that tooth, even when they grinded it down, the filling still there. And when you take something metal on fillings, and then when they sprayed cold water on it to clear it off before, yeah, it was so sensitive. Yeah, so no root canal, thankfully. So they put the permanent crown on. So now I got two teeth back to back. Yeah, those last two teeth are crowns, and they're permanent now. So yay! Okay, next week is a lot of doctors. Next week, Monday, I go see the ENT for my final approval to that Inspire sleep apnea device that will be implanted. I don't know with my upcoming diagnosis for myasthenia gravis, I pronounce it. I don't know if that's gonna make it so I'm not gonna qualify for that sleep apnea device implantation or not. Maybe it'll make it to where it's even better for me to have that. I don't know because that the MG deals with the muscle, the nerves giving signals to the muscles to move. And last few days I've had tingling in the tongue now. Besides my droopy eyelids, double vision, blurry vision, feeling really tired a lot easily. I tire out easily. My tongue is starting to get tingly. Even right now, my tongue feels a little tingling. And so I'm worried that that's the start of the MG starting to affect my tongue, which if that's the case, eventually it could affect mine being able to talk, being able to chew, and to swallow. I'm really concerned about that, folks. I am. That means that I could be going into general MG and not just uh, ocular MG. So I'll talk with that to my neurologist on Thursday. But I'm scared to death. It's already going into general MG. Thankfully, my arms, my legs aren't affected yet. I'm not feeling any weakness. I don't get tired easily when I walk, when I use my arms. So that's good. I'm not having that kind of effect. It's all up here in my head right now. So, but yeah, so the ENT will check. Most likely, he'll want to do if he says that MG is not a factor in whether or not I get final qualification to have that implant device for sleep apnea, then he's going to probably want what I've been reading up on is he'll want to do a scope test, kind of like an endoscopy where they stick something down your throat and check to see how your throat collapses when you're sleeping. So it's mild anesthesia. They'll put you under and they'll put a scope in and they'll see how the muscle, your tongue muscles, whatever, collapse in to see how it blocks your airway when you sleep. And that will be the final test to see if I qualify for the Inspire device for sleep apnea. So that's on Monday. Uh, Tuesday is when I go have my heart stuff checked out. I have 3 appointments at 9 o'clock, 10 o'clock, 11 o'clock, but they're all in the same place, so hopefully it won't take that long. It'll be one after the other. The first one at 9 o'clock, I'm having an echo done on my physical's done, I'm going to have a stress test completed. And then after that, they're going to put on the Holter monitor. And that's a 48-hour time. I wear the Holter monitor for 48 hours. They're just checking my heart out, especially with my bradycardia, with everything I have going on. They want to make sure in the last ultrasound, or this was it, the MRI, yeah, whatever it was, showed something going on with my left ventricle of my heart. Like with some possibly mild hardening. I don't know. They just want to check everything out to make sure that's okay. So the Holter monitor will go on last, and I'll have to wear that for 48 hours, which is good timing. So I should be able to take that off sometime on Thursday around 10 or 11 o'clock, depending on when it got put on. I just have to have it on for 48 hours because my Thursday is when I go see the neurologist, but that appointment's not till 1:30 in the afternoon. So that's good timing. So I'll be able to take off the Holter monitor myself. Hopefully, they say you have to come back into the hospital to have them take it off. But I did have this done before many years ago, and they just had me take it off and drop off the equipment. They'll take it off after 48 hours and then just drop off the equipment so they can read it. So hopefully that's the case with this one. I'll find out more on Tuesday. So I should be able to take off the monitor myself before I go to my neurologist appointment Thursday afternoon. So that's the update on all that fun stuff. All right, so let's get to this. I'm gonna do measurements first, and then I'll check my blood, and then I'll do my Mounjaro shot of 2.5. I'm waiting to see the neurologist first. Then I'll call my primary doctor's office and ask them to go. I want to go up on this, especially to see what the blood work. My poke my finger where my blood sugar is at today. But with me gaining weight, and my appetite's back. My appetite is so back. I don't know if it's because it's medicine or could have been just the diet. No diet. I don't know, but my appetite is back. I'm struggling to control my eating. And of course, with this, me being tired all the time, with this potential MG that I have, I'm not exercising. I haven't gone to the gym. I'm not even doing my walking. I know I need to get to that, but it's hard to do when you're tired, when you work all day. And you have this stuff, you're really tired. Your eyes are really tired at the end of the work day. So it's hard to do any type of exercising. It's one of the bad things about MG. So, but okay, let's do my shirt's kind of off, folks. So if you don't want to see me with my shirt on, go ahead and fast forward or pause the video right now. Okay, so my measurements 2 months ago, it was 8 weeks. It's been 8 weeks since I did measurements. Both my chest and my gut measured 47 inches each. So let's see where we're at today. I always try to make sure I measure in the same spot and with the same amount of tension. So I always do it over my man nipples. All right, same tension. Oh God, folks, this ain't good. It was 47 inches. It's now 49 inches. Ugh. Let me write that down. 49. So I gained 2 inches around my chest. I was worried about that because I've gained some weight. So let's do my gut here before I get into any anything else. All right, make sure it's in the same spot around my belly button. Same amount of tension. Man, I tell you, my gut and my man boobies are in sync. 49. Oh my God. I don't know why my measurements are always the same. Okay, so 49, 49. So both my chest and my gut, I gained 2 inches each on them. All right, so last time I had my measurements of 47, 47. Let me see what my weight was at that time. Okay. So my weight was only 225, so it was only 5 pounds less than where I'm at right now. So that don't make a whole lot of sense. Only 5 pounds added 2 inches from my chest and my gut. Of course, that could be because I'm losing muscle. Because I said I'm not working out at the gym. So I could be replacing muscle with that. But they always say muscle weighs more than fat. So I don't get gaining 2 inches both chest and gut with only a 5 pound weight gain. That don't make sense to me, folks. But I'm not an expert on that stuff. Definitely not. All right, so let's check my blood sugar. I got my this here. Voila. All right. So wipey. I like to do my middle finger. So it's alcohol wipe. All right. All right. So I'm gonna try to get blood down into the finger. All right. So there we go. Got my pointy thing. Ouch. Hate that. All right. At least I'm bleeding good. All right. I'm gonna put my test strip in. Alright, so there we go. Waiting. There it is. Put the blood in. There we go. Apply more blood. Okay. There we go. Go down to fasting, so I haven't ate anything yet. Alright. Well, good news is it's 87. So that's usually where it runs. It's usually in the 70s or 80s, so that's not bad. I thought it would be more than that, especially with the weight gain. So that's good. But it also counteracts my message to my primary doctor. I want to give her saying, move me up on Mounjaro. I want to go up to at least, I'm on the lowest dose of 2.5. I want to go up to 5. Mainly because I need appetite suppressant. I need it more for the weight loss, especially with this disease. You can gain weight on it, especially for the thyroid disease and also for MG. Especially if I do get officially diagnosed with it, which I'm sure I will. That the medication they put you on can cause weight gain, so I need the extra for that. I need the extra help controlling my appetite and everything, which Mounjaro is very good for that. It slows the processing. For those who are not familiar with Mounjaro, it slows your digestion of your food. It slows it all down. Food from emptying then when you eat your stomach, it slows down the digestion of that in your stomach. So that the food going down from your stomach into your intestines to digest it all through, it slows that process all the way down so you stay full longer, which helps control your appetite. It also has appetite suppressant. I don't know how it does it, but it does it. Your appetite's not very strong when you're on, especially when you're on the higher doses of this. I've been on up to 7.5 in the past. So I'm still gonna ask her as soon as I hear from the neurologist. I am gonna ask my primary doctor to move me up to 2.5. So okay, folks, let's go ahead and do my shot. For those of you that haven't seen it before, you remove the cap, the needle's in there. It stays in lock position. You want to unlock it, and then you want to inject it either in your belly, at least 2 inches away from your belly button, on the fat part of your arm, or fat part of your inner thigh. I like to do the gut. All right, I just came out of the shower, so I'm nice and clean. So I did this side last week, so I'm going to do this side this week. You can see the needle in there, so you're gonna pick a spot. Okay, you're gonna push down on your button. You're gonna hear a click, and you're gonna watch the needle go in. And then as soon as it's done giving the medicine, it'll retract, and you'll see it retract. But then you also hear that second click telling you that it's retracted. So here we go. Get in here. Okay, the second click, it retracted. I saw it retract. Ooh, I got some blood this week. Thanks. All right. All right. That's depending on what you hit. Usually you don't get blood, but if you hit like a small blood vessel or something, you can get blood. So it's just a little drop, and it's already dried up. So, all right, folks. I don't know if I have anything else for you this week. Yeah, I don't think I have anything else for you. So stay tuned for more updates next week. And next week I have a lot going on this next week. So please join me next for my next week's Saturday's video for hopefully a lot of updates for you on all my medical issues. So all right, if you like this video, go ahead and hit the like button. If you want to make sure you get notified when I post my weekly videos, I'll start at some point. I'll start videos on just talking about my myasthenia gravis, but I'm going to wait to do that until I get officially diagnosed. Then I'll start doing separate video blogs of that. I'll still provide weekly updates on my Mounjaro journey for MG, but I will do separate vlog videos to go more in depth on MG once I officially get diagnosed with it. All right. All right. That's it, folks. I'm going to end it with my usual message. Now, enjoy life. You don't know what's going to happen. You don't know what's around the corner. Tell your loved ones you love them. But just, yeah, enjoy your family, enjoy your friends, enjoy life. Just don't run ragged. I know it's hard to do. I know we all have to work. We all have busy lives. So, but don't forget to take the time to smell the roses, as they would say. So, all right. Have a good one, everybody. See ya.